Hi, this is Dr. Victoria Andarcia. Thank you for joining the Healthful Roots podcast. Today, I have Dr. Marie Dona. She is a triple board certified physician who specializes in child, adolescent, adult, and perinatal psych, as well as obesity medicine. Today, we're going to be focusing on the perinatal psychiatry side, just because it is something new I haven't heard of, and I know that my listeners would benefit from. I'll give you the floor.
Yeah, well, thank you so much for having me on your podcast, Dr. Andarcia. I am definitely very excited to be here. Yeah, perinatal psychiatry, I will say it's definitely an interesting and I think burgeoning field, but I think there's also a reason that you hadn't really heard of it in that there's no actual fellowship for it that is approved by ABP, and those are the licensing boards for psychiatry, but there has been more interest and specific trainings in perinatal psychiatry specifically. And there's a reason why, in that I did adult general psychiatry training, and then I did some specialty training in child adolescent. But during adult training, there we definitely do touch upon women's health issues, especially pregnancy, postpartum, but it's brief. Like it's not, it was never kind of this kind of specialized thing. It wasn't really touched upon. But then I think just more and more information data out there, they realized, wait, no, this is a pretty significant thing that has a lot more nuance to it, that deserves its own interest, research, data, literature, training on specifically. And that's where it became more of a field that psychiatrists have started to specialize in and get additional trainings and certifications in specifically.
There are probably so many things you were exposed to during your residency rotation. What was it about perinatal mental health that really got you started on this track?
Yeah, so I mean, I've always thought it was interesting just how, so mental health has always been obviously hugely interesting to me since I am a psychiatrist, but then for women in general, just so many things like hormonal fluctuations, how they can play such a huge role in someone's overall mental health, their well-being. And that was something that I noticed in residency training and throughout my life. And then just in general, like being a female, having to go through cycles and the hormonal fluctuations. So that was just something that was apparent. But I will say my interest in actually pursuing and becoming more educated in perinatal psychiatry honestly didn't come until after I did all of my training, which was a general adult psychiatry training, child adolescent psychiatry training, being in my own private practice, and then actually having to navigate that space myself personally within perinatal psych, which was fertility, infertility, loss, etc., and having gone through it myself personally. So as a psychiatrist and as a physician, I feel like we're always trying to educate ourselves, but then it hit me on a personal individual note when I had to navigate actual issues with miscarriage, loss, and infertility. And that's where I was already in the psychiatry field. I was like, hey, there definitely should be more information out there. And then when I actually dug deeper, that's when I found that this field was a thing that people were trying to get more educated in and needed more support in. And that was what actually pushed my interest in getting certified in perinatal psychiatry specifically.
That is interesting, right? I feel like a lot of healthcare workers, when they pick a field, most of the time it is because they've had personal experience in there. And that's why I decided
Yeah.
to do women's health with hormones, because when I struggled through it, I was like, if I can't figure this out and I'm a doctor, how's everybody else going to do it? Right. So,
Yeah.
yeah. So one of my questions for you is, what is the most common mental health challenge or the challenges that you see in your perinatal patients?
So I will see most common that I will see in perinatal patients. So that would depend on if it's pr- um, pre-pregnancy or like during pregnancy or postpartum, because that can range because I have dealt, quite a few patients of mine have dealt with actually infertility
Mhm.
or miscarriage, like losses, and that is pretty common. And that was actually something that I experienced myself personally, but then without having navigated myself personally, I didn't know it was something that was quite common. I know I mentioned this to you before, but like miscarriages can be as common as 1 in 4, 25%, 1 in 5, which is pretty huge statistic if you think about it. Like every time a woman is getting pregnant, 1 in 4, 1 in 5 may result in a loss. But even as a physician, I didn't really know that was a thing until I had gone through that myself. And then with that, so prior to pregnancy stage, that is something that does happen quite commonly. But honestly, without the knowledge that there are resources out there, it's quite isolating. It's like that's when women will blame themselves. There's something wrong with me. What's wrong with me? What did I do wrong to cause this loss? Or why can't I get pregnant? When actually digging deeper, research, literature, resources, they will tell you it's honestly probably not you. Just so many other factors and things come into play with that. And I think that awareness that these resources and opportunities for help are out there, but without more awareness and people talking about it, just because again, this is one of these topics that I think is better than it was in the past, like a few years ago, but still no one really wants to talk about miscarriage. No one really wants to talk about loss or infertility, but it has gotten better, but it's still something that does feel a little bit more taboo, like a little bit more stigma, like a little bit more shame when it comes to talking about specifically. But one of my goals was to try to help remove that shame, that stigma, just because I think with more education, awareness, and knowledge, that can be empowering to help people know they're not alone when they're going through these issues. So, yeah, that's what I will see a lot in the pre-planning stages of pregnancy. And then a lot of times during pregnancy, it's navigating their ongoing issues, whether it is anxiety, depression, and then what that means in terms of continuing medicine or what they're going to do or decide to do with their medications when they're pregnant. And then on the postpartum, most commonly, I will be seeing if there are exacerbations of postpartum anxiety, postpartum depression, and then while not as common, like postpartum psychosis, postpartum mania, postpartum bipolar, are all things that can happen. But for the most part, from in the postpartum area, it is more so like anxiety, depression. During pregnancy itself, it is more managing, maintaining already comorbid depression, anxiety, or if it actually manifested within pregnancy itself. And then prior to pregnancy, it is the realm of either infertility or losses and navigating how that can affect someone going through wanting to explore their reproductive life.
Okay. And that's all great information. I feel like I have a question from like every phase. So,
Mhm.
starting with the pre, conception part, with you have struggled with infertility or pregnancy loss. Um, One is, do you think that just the knowledge that you can provide, have you seen that just knowing that it is as common as you say it is, that that can bring relief to any of the feelings that they're experiencing?
Yeah, so I think that knowledge definitely can bring some relief just because it's like people, when they go through these things, they immediately feel alone. They immediately blame themselves. And then they're just, they, all these questions of what did I do? What is wrong with me? Why can't I become a mom? But then if you actually know the research, the data, the evidence that's out there, 1 in 4, 25% is huge. Like that is like a huge number and a lot of loss that just honestly isn't talked about too much. So then the isolation isn't as there just because it's kind of like it doesn't necessarily take away the pain. Like the pain will still be there, but it's along the lines of, hey, it isn't just something is completely wrong with me. It's just an issue that can happen that maybe isn't talked about as much. And then also get what can be empowering in giving someone knowledge or data around why loss might happen or why infertility itself might happen. And that can be empowering in a way for a person who is navigating either of these issues to potentially explore them, whether it is seeing their OB or exploring whatever could be causing either the issues with fertility or pregnancy loss in general, and just getting more education about that besides just something's wrong with me, what's wrong with me, what did I do wrong, etc. And all that self-blame that ultimately isn't helpful and just perpetuates these ongoing feelings that can deteriorate someone's mental health
Yeah.
when it comes to all this stuff. Yeah.
Well, and then just a follow-up question for that is how, from your experience, can a spouse or family support someone who's gone through that? Because like you said, it is a little like taboo. And so sometimes you're like, what should I say or should I not say anything at all? How can we support someone who's gone through that?
Yeah, so how a spouse, partner, or friend can support someone going through these things is, just letting them know that they're there. So these things are incredibly difficult to kind of go through, and it can be really isolating. But, just letting your loved one know that you are there if you need them, asking them if there is any way that they can be supported in any sort of way, opening that door to communication, and just knowing, okay, someone might not want to talk about it today, but just continuing to check in on them. And also just kind of recognizing too, I will say telltale signs when it comes to mental health decline are when activities of daily living are declining. So say someone usually eats pretty well, sleeps pretty well, but all of a sudden they're not sleeping, or they're sleeping way too much, or they have a pretty good appetite, but all of a sudden they're not eating at all, or they're eating excessively. Like big changes in how someone is managing their life. Like those can be telltale signs, and not just one day or one week, but this will be ongoing. Noticing big changes in someone like that, or say someone is very outgoing and spends a lot of time with their friends, but all of a sudden they're isolating themselves. They don't want to see anyone, or they're really happy and bubbly, but all of a sudden they just can kind of seem sad, down, or irritated all the time. These would also be telltale signs to maybe encourage someone that they might need additional support, or impairment in functioning. Like they do well at work, but all of a sudden they're not going to work, or they're doing poorly in work, like starting fights within the relationship that weren't really there. Like all of these things that
Yeah.
can indicate something is going on that's a little bit deeper. And I'm going to say, honestly, loss and infertility, they're incredibly difficult to deal with. So I think it's understandable that someone might need some time to try to help support themselves and heal through this journey. But when things are really, really impactful or actively impairing someone's quality of life, that is a big indicator to me that they probably will and should receive additional supports, either behavioral or medication wise.
Okay. And I mean that's really good to know, and it leads me to the next questions about medication. So when someone gets pregnant, how do you navigate? I know it depends on the kind of medications that they're on, but how do you navigate that medication situation?
Yeah. So it's very individualized in that there are definitely some medicines that are not safe for pregnancy, like some mood stabilizers, like Depakote, et cetera, like that, are not safe for a viable pregnancy. But I will say, and this is a very blanket statement, and all, of course, this needs to be individualized, but the evidence will show, honestly, that if a mom, that someone who was taking medicine and had a pre-pregnancy mental health issue, anxiety, depression, bipolar, psychosis, etc., they were doing well and they were doing stable on that medicine. The evidence will show that that stability is going, and risk versus benefit profile, right? That the stability of maintaining mom's mental health is going to typically outweigh any potential risks of that medicine. And then again, this is very individualized based on the medicine that they're taking, the medicine class, but all the evidence has shown that destabilizing someone on a medicine, someone is taken off a medicine that has helped keep them stable in terms of their mental health, anxiety, depression, mood, psychosis, etc., that can play a significant role in the decline of both mom and baby during pregnancy and itself. And yeah, the risks are usually overriding, like the risks, the benefits of continuing the medicine are usually higher than the risks of destabilizing someone's mental health if they're already stable on medicine. But of course, that's a more nuanced conversation and
Right.
individual based conversation.
Yeah, like most things in medical field, it has to be individualized. But yeah, okay.
Yeah.
Just want to put that out there.
Hmm.
Oh, and then one
Yeah.
of so for the postpartum situation now, what is the difference between like baby blues and then like postpartum depression? Like where some what at what point does someone need to say like I need help?
Yeah. So baby blues, I'm going to say honestly, really common. So like baby blues, I'm going to say majority of people will go through it, and that happens because of the big change in hormone fluctuation right after delivery. So that will typically happen within the first few weeks after delivery. And yeah, it's so common. I'm gonna say anywhere from like 80% of moms can experience this. And this can be anywhere with mood swings, irritability, crying, feeling overwhelmed, anxiety. And it typically begins within the first few days after delivery, just because, yeah, the baby's out, all the like huge change in hormones that the body has kind of gone through. But what will typically happen when it's just baby blues is that it'll be short-lived. So it's usually within first few weeks or so, like 1 to 2 weeks after delivery, and then will typically resolve on its own without any specific treatment besides, taking care of yourself, like support, rest, family, friends, like that type of thing. And symptoms are typically mild and don't actually interfere or impact daily functioning or ability to care for themselves or the baby. But when it actually becomes postpartum depression, and yeah, so when I said baby blues, anywhere from 80%, so it sounds like a majority of people like postpartum depression, a lot less common, but can still be common, anywhere from like 10 to 20% of moms. And this is where it's not just some mild symptoms of irritability, mood swings, depression, and not just for the first a few weeks, like 1 to 2 weeks, but prolonged, like several weeks after delivery. And it's like persistent sadness, hopelessness, intense mood swings, difficulty bonding with baby, not being interested in things that you used to be interested in, feeling really tired, changes in appetite, like an impairment of functioning is a huge thing. So with baby blues, yes, like mood swings, irritability, crying, not fun, but still kind of able to do what you need to do to take care of yourself, take care of baby. But then postpartum depression, that's when it becomes more of a potential issue when, oh, not sleeping as well consistently, not eating as well, or changes in eating consistently, not being able to take care of baby, or in severe cases, potentially even harming baby, like those types of things. And this would last not just the first few weeks or even the first month, but several weeks or several months after delivery, just because that's when, it's not just potentially due to that huge hormone fluctuation, but ongoing symptoms that actually need to be addressed.
And do you think that there are any risk factors for developing postpartum depression?
Yeah. The biggest general risk factor is if someone already had pre-existing anxiety. So say, or depression. So if someone already had a pre-existing mental health issue, yeah, like depression, anxiety, mood issues, etc. And even if it was being adequately treated, there is more of a chance that someone will develop postpartum depression, already having that comorbid mental health history along with that. But then there are other things that can contribute to that too, like, and I would say they can be more environmental in nature, like if this was an unwanted pregnancy or not supportive partner, financial resource difficulties, a really, really difficult delivery or postpartum era, recovery, all of these things, that is where that environmental aspect can contribute to postpartum depression specifically. But from like a physiologic, biologic, it is more if someone already either had a family history of mental health issues or they themselves had mental health issues even prior to pregnancy.
And just like a little off of that, is that the same for like postpartum psychosis? Like you would,
Hmm.
okay.
Yeah, yeah, pretty similar. But I will say postpartum psychosis is even like, if postpartum depression, 10 to 15%, postpartum psychosis is going to be like 1 to 5%. Like, and that is not uncommon, but can happen.
Okay.
But yeah, I would say that would also especially happen if, say, someone had a pre-existing like schizophrenia or psychotic disorder or family
Okay.
history of that and presenting itself, but also not even all the time too. Like I've also seen and experienced women who have had postpartum psychosis with no sort of genetic or pre-existing psychosis history. So that's where it can happen sporadically as well.
Right. And this is like a random question. Just thought about it because I've talked about it with my friends. Do you think personality type has anything to do with that too? Like being type A, like really rigid, because now like things are kind of out of your control, you have a newborn, like maybe you have to be more flexible in your ideas. Do you think that affects that at all?
I would say personality can have an effect on some of these things, and the ability to be the ability to be adaptable will be
Mhm.
beneficial in basically any mental health condition, anxiety, depression, psychosis. I'm not going to say for psychosis specifically, but for maybe in general postpartum issues like anxiety or depression, there might be more likelihood of developing those things if someone is more of a type A, if they haven't developed coping skills to help navigate. Oh, yeah, I can't be in control of everything. Or now, yeah, life is going to look a lot different having a baby or a newborn with me, those types of things, and being able to navigate different stressors like sleep deprivation or, lifestyle change, et cetera, et cetera. And if they're first time moms, like never having experienced pregnancy before, because this is a completely new stressor that someone hasn't been through before,
Right.
et cetera. Yeah.
Okay. And do you like incorporate or recommend any alternative therapies like acupuncture, mindfulness, anything like that?
So I will definitely recommend behavioral interventions, mindfulness, meditation on a regular basis for all patients, not only perinatal, but child, adolescent, adult, whatever. I do think they are definitely beneficial, but we'll also recommend these for perinatal patients. Kind of specifically, and especially because there is more caution regarding medicines in general, that's when I will also recommend the behavioral interventions more like therapy, mindfulness, meditation, kind of exploring. I'm also advocate, for say if they've struggled with other things like psychodynamic therapy or dialectical behavioral therapy, if they've had difficulty with emotional regulation. In terms of recommending things like acupuncture, um, it's not something that I will say I have read about it and how it can potentially be helpful, but it's not something that I will say that I will give as yeah, this is definitely something that I would recommend, but I have seen and read some evidence of its utility.
Okay. And what are the therapies? Like when someone comes to you, what can they expect?
Yeah, so I'm a psychiatrist, but I'm a psychiatrist who loves incorporating therapy. So my go-to is cognitive behavioral therapy, and I'm going to say that's honestly probably the most evidence-based therapy for depression, anxiety. Like EMDR is used for trauma, and there's a lot of different types of therapies out there, psychodynamic, psychoanalytic, but I'm a huge advocate for CBT. And again, a lot of the evidence is there that this is one of the most effective behavioral or therapeutic interventions out there. And that is based on, just understanding how your thoughts can influence your emotions and can influence your behaviors. And that's how I really tackle it from a behavioral intervention. And then again, I'm a psychiatrist, but I will always recommend behavioral interventions first. But once someone's already either engaging in therapy, behavioral interventions, they're doing all they can in terms of regulating their sleep and their appetite, just because these are huge things too. And I'm a huge advocate for, making sure that you're actually taking care of yourself, because if someone's not eating and sleeping, they're like, oh, I'm having so much anxiety, I'm so depressed. Well, like if you're exhausted all the time and barely nourishing yourself, yeah, that completely makes sense to me, because your mind and your body is not rested. It can't regulate itself. So I always check in on these things, emphasize these things. But say someone has done all these things, behavioral intervention, seeing a therapist, working on their diet, working on their nutrition, working on their sleep, getting a physical activity in, but they're still having impairment or issues, or not able to function as best as they were before, or in general, that's when I will consider medicines. And I have really seen medicines be beneficial, but I'm not someone who pushes them immediately, but I have seen their utility quite often in my
Right.
practice.
Right. No, and I agree. I have seen as well how beneficial the medications can be. But I love that you said that, you have to be eating right and sleeping correctly
Yeah.
and movement has to be part of your thing because, the way that I work with people is like, if that's not taken care of, I can give you any
Yeah.
supplement, I can give you anything that you
Hmm.
want, but it's really not going to make a huge
Hmm.
impact, right? You got to get the basics down.
Yeah, I like it's like an ongoing conversation I have with my patients, and that like, hey, we really need to get back to the basics first, because as human beings, like if you're looking at the hierarchy, we all need some things to live and to just function in general. Sleep is one of them, nutrition is one of them, then shelter over your head is another one. But like these things are not ideal or off. Of course, they're going to impact like every other aspect of your life. So this is where, yeah, I can give you a medicine, but the other thing I say too is medicines I are never a be all end all. Like they can be helpful and they can be supportive, but they're not going to solve all of your problems. Like that's where everything else that we're discussing here comes into play.
Yes, yes, I agree. Because it still doesn't take care of the underlying issue, which is like the coping
Mm-hmm.
skills, or and that's where CBT would come in and all that. So I
Yeah.
definitely agree with
Mm-hmm.
that. And you know, if someone was suspecting that they're experiencing postpartum, I think sometimes like depression or anxiety, sometimes when you're in something, I think it's hard to see like outside of that situation. So for any woman who feels like maybe they're in that situation, how do you think that they can, what are the signs that they can look at personally, or when should they think like, hey, I need to go to someone?
Yeah. So, I know it can be incredibly difficult when you're in it to kind of see, to have that insight. Oh, like something is going on. But this is where I would encourage basically everyone to check in with themselves, because I'm gonna say honestly, most people probably just don't take that time to check in with themselves. Like, how am I doing? Like, it does feel incredibly hard. Yes, pregnancy, postpartum is an incredibly difficult experience, but is it just hard for me to do basic things, to get out of bed, to make food for myself, to eat, to sleep, to bond with my baby? And do I feel like I'm so tired that I can't do anything? Do I feel like I don't want to spend any time with my child? Do I feel so down and depressed every single day? Like just kind of asking themselves honestly, does my life seem very different now that I have had this child, that it's way worse, or that I'm not functioning at the way that I used to? And if you're saying yes to all these things, there's honestly really nothing wrong with checking in with someone. And there's so many ways to do that. So OBs make it good in that you typically have to do like the 6 week check-in to make sure that everything's okay physically, but they'll typically run screeners as well too, to check for if there are any mental health concerns. But this is where, say you've never even explored behavioral health or mental health aspect, you can just ask them like, hey, like I'm feeling so anxious that I'm having like anxiety attacks every other day. Like, is this normal? Or I'm feeling so sad or so down that most days I don't want to get out of bed. And then this is where usually people, yeah, like OBs, they will be able to kind of help direct you or guide you. And like, okay, like there are these resources out there. But say, not even wanting to explore from the OB route, but then there's just kind of something where you're like, something feels off, something feels weird. I would encourage you to, even just kind of research. Like, there are resources out there, and it can be intimidating and it can be scary, but there are so many different ways that you can get help and support. So, like, there are so many therapists available, either virtual or in person, and there's so many different platforms that you can look into as well too. So the one that I was telling you about earlier, I can also send you the link. There's postpartum.net, which is like perinatal mental health directly related to. They have a bank of resources of therapists and psychiatrists in each state. So they have things like that available. Or just even if you are willing, and I know this is where it's hard, it's incredibly hard and scary to be vulnerable, but say you're completely naive to the mental health world, asking friends, asking family, like, hey, like I'm kind of going through this. Like, do you have any experience with this? Because I'm going to say, while mental health still kind of has this taboo and stigma, I do think it is becoming more open, and people are willing to be helpful. Like, it's scary to be vulnerable, but being vulnerable invites other people to want to help you. Because, like, people can't read your mind as much as people can try to watch out for these things, unless you're letting people know honestly what's going on with you. That does make it a little bit harder. But say you have good friends that kind of went through something else. Nothing's wrong with asking them, hey, did you kind of go through something similar? What did you do? Like asking them if they have any experience in what they have done in terms of trying to receive help. And just know that there is help out there. It can be scary and intimidating, but just starting anywhere, asking anyone, friends, family, like partners, your OB, your piece, like your primary care doctor, like anyone within the medical field, like if you're seeing them for any reason, that they should be able to potentially help point you in the right direction. It just starts with your willingness to kind of say and acknowledge something's going on with me that I think I should be trying to explore or get help from here.
And I love that you said that because in my mind, I wasn't even thinking about that. I was like, how can we watch for the signs? But about being vulnerable, right? Because you're right.
Yeah.
Like if you have like a, loving community around you, which, a lot of people do, then they
Yeah.
should want to help you. So that's
Yeah.
something good that you said. Because with my friends who've had kids, I know they don't really say anything until like that moment has passed, right? Like I can think of one specifically where like they weathered the storm alone, but if they had just said something before, like we would have been there, right? But you kind of have to
Yeah.
just know what's going on. So,
Yeah. It, I think it's incredibly hard, like just because it's like we watch out for these things, but then at the same time, too, sometimes people don't want to overstep. So this is where I think it's like a give and take
yeah.
with the friend and the family and the person themselves, just because, well, ultimately, at the end of the day, it is still the person going through their issues or concerns that have to be the one to say, hey, I'm ready and willing to address this issue, you know, going on, which I know isn't easy in itself too. But I think that this is just like opening the door, having a question, asking someone, just letting them know, like, oh, I've been having like so much trouble sleeping and it's really affecting me. Like just anything that will kind of indicate, hey, there's something going on, I think will open the door to for that person to be able to get some sort of help or support in some sort of way.
Yeah, no, I totally agree. And I love everything that you've said. And I've learned so much because when I was looking, I was like, perinatal psych, like, what does that even really do? Like, what it is? But you've provided so much clarity. And I think just for anyone who's listening who knows that this is out there, that also makes it easier to know, like, if you're going through something like, hey, like, I heard this podcast and there was perinatal psychiatrist on it. And then it just kind of, you bringing awareness to this field is also helping a lot of people. So thank you for that.
Oh.
And then for anyone who wanted to get in touch with you or know more about your practice, how can they do that?
Sure. So they can always go to more information about our practice is on my website. So it's www.donawellnessclinic.com. So Donna last name is Dona wellnessclinic.com. And then for the social media, it's the same handle, like so facebook.com like at Donna Wellness Clinic, Instagram.com, Donna Wellness Clinic. I also have a YouTube page which has like 50 plus videos on everything mental health, wellness, like related, have a few topics on perinatal psychiatry specifically. And I started that channel just to provide information, just because even for my own practice, I just wanted to have this resource available for people because as much as I might share this information, like people's minds aren't infallible. They might forget things. So like just to kind of have that to reiterate. And I think knowledge is power. So that if you're interested in more information about psychiatry, mental health, and wellness, the YouTube channel is also great way to learn more about the clinic too. So Facebook, Instagram, all at Donna Wellness Clinic is a best way to get in touch with me or reach
Oh,
me.
that's
To
awesome.
if you're interested in joining my private practice as well too. So located in Florida, but I'm actually licensed throughout the state of Florida, and I see people via telehealth in New York, Pennsylvania, and Washington, D.C. as well.
Oh, that's awesome. Yeah.
Mhm.
Yeah, and I'm gonna link all that when in the show notes for especially the YouTube channel, which would be definitely very helpful for anybody who wants a little bit deeper information on what we covered. But I want to thank you so much for being on the podcast. I know that I learned a lot and others will too. So thank you again for your time.
Thank you so much for having me. It was really great being on here, and I appreciated you taking the time to chat with me today. I think it was a great discussion.
Yes, thank you.